Alright, class, let's get this lecture started. Hello, I hope you are all doing well today. The lecture I have prepared for you today is on the very relevant topic of COVID, and I hope that it gives you a little more insight into how these patients are treated in the hospital. Please feel free to stop me at any point during this lecture to ask questions or make any comments. Alrighty. So, as we all know, COVID is extremely prevalent in today's society and will be a relevant issue for years to come. According to the CDC, 541,289 people have died in the United States as a result of the coronavirus. This issue also affects different countries differently. As you can see in the graph on the right-hand side, there's a drastic difference between Mexico's mortality rate and the US's mortality rate. So compared to the United States' 1.8% mortality rate, Mexico's mortality rate is actually above 9%. To fully combat COVID, there needs to be work done both here in the States and in other countries as well. So, as incoming nurses, it will be just as important today as it will be tomorrow to understand the coronavirus and the appropriate nursing interventions in the healthcare system. The coronavirus will be seen throughout hospitals for years to come. It is the responsibility of the nurse to advocate for their patients and to be properly informed of the disease process, proper interventions, and prognosis of the disease. As you can see, I've just pulled up some structures involved with the coronavirus, but in terms of the general characteristics of the disease, the coronavirus is a single-stranded RNA virus. There are several different types of coronavirus, such as the 229E, OC43, NL63, HKU1, and these can typically cause the common cold or symptoms of the common cold in immunocompetent individuals. But SARS-CoV-2 is the third coronavirus that's the most prevalent version, which has gained momentum in this past year and a half. The virus has a size of 60 to 140 nanometers and has the appearance of a solar corona. So as you can see in these photos, some general structures of the coronavirus and some general types of the different types of coronaviruses. Alright. So moving on to the pathophysiology of this disease, the virus is inhaled and binds to the ciliated cells of the nasal epithelium via the ACE2 receptors. The virus replicates and propagates with little immune response. The virus then migrates to the upper respiratory airway and the lower respiratory tract, which then leads to an invasion of the type 2 pulmonary alveolar epithelial cells via ACE2 receptors. A cytokine storm is then released, which is part of the immune response, and causes increased inflammation in lung tissues, causing lung injury. This ultimately leads to alveolar damage and ARDS, or acute respiratory distress syndrome. Coagulation is also affected in the pathophysiology of this disease. Inflamed lung tissue and pulmonary endothelial cells may result in microthrombi, which can further thrombotic complications. And as you can see, there's a brief overview of the pathophysiology of coronavirus. But in terms of the transmission of this disease, the disease is mainly transmitted via droplets. And droplets usually travel less than 6 feet from one person to another, and risk is increased if time is spent within the 6-foot range for more than 15 minutes. Contact of surfaces with droplets on them, and then touching one's mouth or nose is also a valid form of transmission. However, this is significantly less prevalent. Aerosolized transmission may also occur, but is the least prevalent of all, unless there's an aerosolizing procedure taking place. It's also very unlikely that mother-to-baby transmission occurs as well. So, some clinical manifestations of COVID include fever, chills, a cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, loss of taste or smell, sore throat, congestion or a runny nose, nausea, vomiting, and diarrhea. Symptoms that would warrant an emergency room visit include trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or to stay awake, and pale, gray, or blue colored skin, lips, or nail beds, depending on the skin tone. Some complications that could also occur this worsens include pneumonia, trouble breathing, organ failure, heart problems, acute respiratory distress syndrome, blood clots, kidney injury, and additional viral or bacterial infections. On the treatment side of things, the main principles of the interventions are isolation and symptom support. Pharmacologically, this includes antipyretics for fevers, as you can see on the right, and corticosteroids to reduce inflammation. Hydrochloroquine has also been seen to be a pharmacologic treatment in reducing inflammation and improving the patient's immune system. Other medical interventions include oxygen therapy, fluid administration, Lasix administration, and nutritional supplementation. In the scope of the nursing practice, some nursing interventions would revolve around actual assessment first. So the nurse should assess the patient for airway, breathing, and circulation, disability, and exposure. So the airway, when we say airway, this pertains to patency, any dyspnea the patient is experiencing, any abnormal breathing, any cough or any sputum. Breathing pertains to tachypnea and oxygen saturation, preferably above 96%. And circulation could pertain to capillary refill, tachycardia, blood pressure, and signs of shock. Disability could be assessed by looking at the level of consciousness, pupil reflex, previous history or comorbidities, drug use, history of fever, and blood glucose levels. Exposure should account for assessing the contact history of the patient 2 days before and 14 days after the onset of symptoms. Some nursing interventions for the patient with mild to moderate symptoms could include promoting sleep, monitoring vital signs, encouraging personal hygiene, encouraging fluid and protein intake, administering both pharmacologic and non-pharmacologic treatments ordered by the physician, monitoring labs, and administering oxygen to maintain an oxygen of, sometimes it's just greater than 90%. Some nursing interventions in critical patients would be a little bit more intensive. Patients might need mechanical ventilation, glucocorticoids, plasma, or antiviral medications such as remdesivir and favipiravir is, I think, one of them. They might also need vasopressors or anticoagulants or other nursing skills that are related to the devices being used at the time. And providing oral hygiene would be important if the patient's on a ventilator. Using SCDs and monitoring the intake and output of patients would also be important. So moving on, so depending on what part of the hospital you guys decide to work in, post-mortem care of these patients should also be taken into consideration. Proper PPE such as gowns, eye protection, gloves, and an N95 should be worn during the care of the deceased patient. All of the patient's lines and drains should be removed, cleaned with sodium hypochlorite or NaOCl, and sealed with a tegaderm. The patient should be stored in a leak-proof plastic zip bag, and the outside should be wiped down with sodium hypochlorite. Embalming should also be discouraged, and the patient should either be burned or buried at least 4 meters deep with cement placed on top. All instruments used to care for the deceased patient should be disinfected with sodium hypochlorite for further use. Yes, so I don't want to leave you guys here on a rather depressing note, but I will say that nurses have the power to make the patient's experience in the hospital a life-changing one. Whether this experience is one of the patient's last or another chapter in their lifelong story, nurses have a responsibility to advocate for their patients and to be educated on proper care of patients with this disease. I hope that this lecture has given you a brief look into what nurses contend with every day in hospitals all over the world. Thank you for your time, and please feel free to contact me with any questions. Class is dismissed. Thanks.